Without a doubt, childbirth is composed of two elements. The first one is risk factors, whether you or your baby are at risk of dying or being injured. The other is suffering. So when we hear an expression, women suffered in labor, they weren't talking about the risk factors. They were talking about billions of women globally, worldwide, throughout time, who lacked skills. They didn't cope, they didn't manage, they didn't know how to work through or deal with or handle or stay on top of or feel in control, because the idea of having skills for birth is very, very, very new. Throughout humanity, we've been faced with a global truth across all cultures, even though we're all one humanity. And that global truth is hardwired into our cells. You never know what your birth's going to be like. That's absolutely true. You can't practice it beforehand. You have to practice skills in an imaginary way and say, I'm practicing skills that I hope are going to work when I'm birthing. You don't know if they will, and you don't know which ones you'll use. However, if you go into experience without skills, then you have no choice except to either hopefully you find them within yourself or you learn them beforehand. You practice them while you're doing other things in life. You don't have to take time away from life to practice softening inside. I can do it while I'm talking to you. So it's really important to understand that the boogaboo in all births really is women suffering. Since the 1980s, cesareans are easier, they're safer, women can be awake, there's more diagnostic tools to determine whether there's a risk factor. It's certainly in the United States, doctors are terrified of being sued. There has never been a lawsuit that says a doctor performed an unnecessary cesarean. The only lawsuits are it wasn't performed soon enough. Skills will make a difference in how you work through the birth that unfolds for you. That's what's important. Birthing Better families didn't have a goal. We don't get pregnant to have a type of birth. We get pregnant to have a baby, which means that we can use our skills to work through birth as it unfolds. And if we experience discomfort or pain or such extreme pain that we think we're going to die because we feel out of control, Birthing Better families knew that skills would help them rein in that sense of overwhelm. And we could. None of us want to suffer in childbirth. And for millennium, across the world, women didn't have skills. And that's where that phrase suffering in childbirth comes from. With Birthing Better skills, it can change because these skills are for all births. We don't have to like the birth. We just have to cope well. If you're already a parent, you don't always like to parent, but you have to parent well, and that's what we learn. In this lesson, we're going to deal with pain. We're going to deal with tips about pain and pain tolerance and how you work with pain using these soft skills.